and welcome to the live session. My topic for today is more about the frequently asked questions for chiropractors, or what exactly is chiropractic therapy, and a lot of other questions like that. So I have got a few questions from a lot of our members, patients, and I'm going to put up these questions and answer them. Meanwhile, even if you have questions related to chiropractic therapy, physiotherapy, or any of your sports injuries, you are welcome to question me about this, and I can answer it right in the live session. Hi everyone, thank you so much for joining in. And the first question for me is chiropractic treatment safe? Is it okay to do a chiropractic therapy, and what could be the dangers, or what could be the benefits, or what could be the issues? So a lot of people have this thought process or ideology that chiropractic therapy is dangerous. Well, let me tell you that it is absolutely non-invasive. That is, it doesn't intervene at any surgical level. Plus, it is drug-free, so you don't have to take any medicines after doing chiropractic therapy. Basically, chiropractic therapy involves adjustments or subluxations or misalignments which are actually corrected by the chiropractor himself, who should be a trained chiropractor. Now that's a very important thing, that you need to have a trained chiropractor. You can't just get things done from anyone. So if you are doing the right thing, there is no chance of any danger, or there is no chance of any safety being compromised at this level. So chiropractic therapy is absolutely safe, and most of the time you will actually see the benefit immediately or within a week's time, depending upon what exactly is the situation. Ashna Huja has a question: lower back pain since a year, it comes and goes, MRI is clean, what could have gone wrong? So you can say that the MRI is clean. Well, even if your MRI was not clean, even if it had a little bit of issues here and there, depending upon your age, if it was a little relatively having some sort of degenerative issues, it still is absolutely fine. What could have gone wrong? We need to understand what is changing in your lifestyle. What exactly are you exerting too much? Are you sitting right? Are you bending right? If you're doing these things in the right way, there should not be any pain. But let's say if you're not doing that, if you have a hectic lifestyle and you're into a sitting job, you're not changing positions very often, your chair and your ergonomics, if it is not comfortable, or if you are into any activity wherein you are bending too much, probably you're lifting weight, and you're not doing exercise or fitness on a regular level, so there are chances that your back muscles would have been affected by that. There could have been spasm, or there could be a little bit of disc issues. But at 32, I think there is nothing to worry about really, especially when your MRI is good. You can check out that with a physiotherapist. Try some physiotherapy sessions. If you find a chiropractor around you, you can definitely visit a chiropractor who can help you get yourself adjusted, and that should help you to relieve your pain for sure. Hi Samir, good evening. Joef is asking me when am I coming to Goa. I think I'm coming to Goa in August. We are scheduled for Goa in August. Montu is asking me, is there any treatment for GBS? GBS is Guillain-Barré syndrome. Well, it depends on the stages. Montu, what stage of Guillain-Barré syndrome are you in? If it is the acute stage where you are where there is an infection, and there are changes happening on a daily basis, whether it is related to your physiology or whether it is related to your overall status. So there, the priority is saving life first, getting you stable, and depending upon what sort of affected areas you have been into, physiotherapy definitely helps in a long run, and it's important that physiotherapy should be continued. I have seen few Guillain-Barré syndrome patients, and yes, it takes a little bit of time. Sometimes, depending upon the amount of infection, or to the extent which is it affected, the physiotherapy span will also be higher. Okay, so sometimes it may take about a year, sometimes it may take about 2 to 3 years, but yes, the patient gets better. So be positive, and if you know anyone, or if you have seen anyone who's having a GBS, and if they have just come out of the hospital and not doing physiotherapy at all, that's not the right solution. Physiotherapy, mind you, is one of the partial therapies which needs to be done after a patient is out of GBS. Okay, so yes, physiotherapy helps in a long run, and it should be continued in a long time. Pranav Oberoi, no plans to visit Delhi. Nitesh Shugil, waiting for my appointment on Saturday. I have lots of issues. My MRIs are fine and all is good. It's like arthritis. It's from years. All right, we can check that out. So this Saturday, I'm at Lower Parel and Khar, both these places. So if you're looking to see me at any of the places, you can connect with me. My number is, I'm putting down the number for appointment. It is 8660 6738 000. That's the number for appointment. You can call on this number and take the appointment in case you're looking to see me. This Saturday I'm at Khar and Lower Parel. We are based in Thane. Okay, so Monday, Wednesday, Friday I'm available in Thane too. We are based at Hiranandani Estate, Godbandha Road, and we also do camps in different cities like Bangalore, Ahmedabad, Goa, Pune. And the next week, that is from 20 to 23rd of June, we are in Bangalore. Okay, so this is our second camp in Bangalore, and we've already seen quite a few patients last time, and they also have a follow-up. And yes, we'll be looking at a lot of new patients. We already have, I think, 50% of our patient appointments have already booked. So I request you to kindly take up your appointment as soon as possible, so that we can see you to the earliest. Thank you everyone for joining in. So frequently asked questions. One of the questions was, is chiropractic treatment safe? I've already answered the question. The next question is, what exactly are the conditions that chiropractors treat? So what are the conditions in which chiropractic therapy works? Most of the time people feel that it works only for neck pain, back pain, and that's it. So I personally, when I am doing these therapies, one of the most important condition that I treat is frozen shoulder. And it has shown some immense amount of improvement when it comes to frozen shoulder. I see patients getting better in just 2 sessions, even if it is a severe frozen shoulder, because frozen shoulder to heal, it takes about sometimes 1 to 1.5 years. Okay, but if you have the right sort of physiotherapy, if you have the right sort of manipulation for shoulder as well as the thoracic and the cervical spine, which is most important whenever you are doing a frozen shoulder, it is important that the cervical and thoracic spine is also adjusted right, because that's where the pain or the rest of the issues come from. So it's important that, and also it gets stiff over a period of time, so it's important that it gets adjusted. And yes, of course, the shoulder, whether it is your range of motion related to inability to move your hand up, inability to move your hand from sideways, or even doing rotations, or simple conditions like wearing clothes, or probably trying to just reach out in a car, changing gears, all these are problems which are related to frozen shoulder. And yes, it is important that you should see a chiro, and you should also get yourself treated with physiotherapy. And this is one condition specifically what I see very commonly is where chiropractic therapy helps wonderfully. Secondly, I also see a lot of functional scoliosis. Functional scoliosis is not something which you are born with. It is something which you adapt because of bad posture. That's called functional scoliosis, and it is typically seen in teenagers. You can typically see this in the age group of 13 to 16, wherein the growing kids, they are not so very focused about their posture, because of which they tend to sit in a shifted manner, and eventually the spine starts changing that direction, because of which it starts developing into a functional scoliosis. So if you really trace down the spine, you'll come to know that there's a partial C-shaped structure happening probably at the thoracic level or at the lumbar level. And yes, if it is a functional scoliosis in early stages, chiropractic therapy can definitely help. So yes, I see a lot of scoliosis patients who really work, who really give good results post chiropractic therapy, and yes, that is something which we also see. Khanna has a question. Okay, so when and where available in Mumbai, how can I get a well, I told you I'm available in Mumbai on Saturdays. Most of the time I'm available on Saturdays. Okay, if I'm traveling, obviously, then if I'm not in Mumbai. So, but normally Saturdays I'm at Lower Parel as well as Bandra. I have already shared my number for appointment. The number is pinned as a comment. You can check on that. So Khanna says, I'm 27 and suffering from acute back and neck pain. Keep cracking my bones in that area. Is chiro for me? Yes, definitely, because this again is a good question what Khanna has put up, and lot of people at this age has this tendency, or they feel that you get cracked and you'll be fine. That's not the case, and self-cracking has a lot of limitation. When you crack yourself, you don't actually end up cracking everything. Okay. Secondly, we are correcting some adjustments. As a chiro, I am not cracking you. I am correcting certain adjustments. I am checking your subluxations or misalignments, and I am trying to correct that. Okay. So that is something very important. It is not just about creating that sound from anywhere. That is something anyone can do. But that's not what we are looking for. What we do is we specifically cater to certain area, whether it is the upper cervical, whether it is the lower cervical, whether you have certain integrations in thoracic area where we consider the upper thoracic, the mid thoracic, and then the lower thoracic. Depending upon your weight bearing areas, we focus on whether you should be done a lower lumbar or a upper lumbar, and what exactly has to be done there. So these are very complicated things which actually is followed and evaluated and assessed by a chiro, and then accordingly we make those changes. So it may appear that, if you see my videos, you will see most of the time that the actions are the same or the movements are the same. That's because the anatomy is the same. The anatomy doesn't change, but the way to correct is definitely different. The levels which we are correcting are definitely different. So we need to understand that. So yes, Khanna, cracking is for you, and in your words, cracking is for you. But for me, yes, you need to get adjusted. And also, as a 27-year-old, it's important that you also focus on the importance of exercise, on the importance of stretching, and bring that in your daily lifestyle. I think that's also very, very important. One more question I have. I am HTM. My wife always complains about back pain. She's an advocate, but the pain seems to be very severe. Any suggestion? How can we diagnose this? Well, a simple thing what you could do is get an X-ray of the whole spine, preferably, and understand the issues. When does the pain come? The pain comes in the morning. The pain comes in the evening. What kind of pain it is? Is it really a very debilitating pain? Because of which you are not able to do any kind of movement, or is it that pain which comes because of fatigue, because of tiredness? Understanding all of this, I would suggest maybe with a X-ray you can always visit a physiotherapist or orthopedician or even a chiro to understand what exactly is the problem. Nitesh Ugol, does your therapy heal issue completely? That's my question. Whose therapy heals completely? Healing is a partial job, Nitesh. You need to understand, healing is partly it is my work and partly it is your work. Okay, so a patient cannot just come on to a doctor and say that this is my problem and I now need to get it solved. You also need to be a part of the solution. Okay, and how do you become a part of the solution? I always tell this to my patients that whenever you come to me for therapy, I am only doing 50% of the therapy. The 50% of the therapy and the solution depends on you. How are you going to respond to it? Let's say you do a session with me and you feel very good, and after that you don't follow up with the exercise, which 75% of my patients do. They do not follow up with the exercise. I can tell them, because I always ask them whenever they come for follow-up, did you exercise? No. My pain is 70% better, but I didn't have the time to exercise. The problem is that most of the solutions that we look out for are simple, but we don't want to focus on simple solutions. We want complicated solutions. We want medicines. We want complicated medicines. We want expensive medicines. We want more interventions. We want surgeries. But let me tell you one thing. None of these will solve your problem completely if you are not involved there. Even if you undergo a surgery, it is important that you also undergo a rehab. Because if you don't go a rehab, if you don't let your movements again get back to normal, doing that surgery is a complete waste. So same is the case with chiropractic therapy. I will not, close my eyes and tell you that yes, I have a solution for everything and I do everything. That's completely wrong. So my healing issue will definitely solve your problem, but to sustain it, whatever extent you have to, it depends on you completely. That is what you need to do. Hi Ollie, how are you? A lot of people joining in. Is post-delivery physiotherapy different than the regular physiotherapy? Post-delivery physiotherapy, you mean after your pregnancy? Well, after your pregnancy, it is all about trying to strengthen your pelvic muscles, trying to strengthen your abdominal muscles. So it is more of a rehab kind of therapy. Yes, it is definitely different, and it is more to be done by specialized physiotherapists, preferably who have done a lot of antenatal and postnatal physiotherapy. So that is what we call it basically, and it is advisable to see a postnatal physiotherapist, or at least a physio who sees these kind of patients more often, because it's highly advisable for pregnant ladies also to undergo some kind of basic exercises and abdominal exercises, so that post delivery they don't feel that weakness completely, and they don't feel that the abdominals getting absolutely weaker. And yes, obviously if you're following these exercises before your pregnancy, you will definitely do it after the pregnancy. So yes, it is a little different, and you have specialized physiotherapist for that. All right, and then one more question I had about, like I told you, what other conditions does chiropractic treatment works on? So I have already spoken about this. That besides neck, back pain, it also helps for frozen shoulder. It also helps for scoliosis. It also helps in a lot of digestive issues. I have seen a lot of patients who have undergone endoscopy, done a lot of therapy with gastroenterologist and people like that, and then still there are some digestive issues which are still bothering them. And when we do about 2 to 3 sessions related to their abdominals, when we do a MFR for their abdominals, for their organ areas, visceral chiro, which you call, or visceral osteopathy, which you call, that has given some immense results. So yes, I have seen a few patients who have got good results with that. One more question I have is, what should I expect in my first visit to a chiropractor? Well, the first visit to a chiropractor will be, firstly, your mobility will be much better. You will instantly feel that change in your neck, back. It could even be a lumbar spine. A lot of mobility. You will feel quite lighter. Okay. There are chances that your weight bearing pattern also changes. The way you walk. Most of the people don't realize, but you do not walk with equal amount of weight on your legs. There is always a little more weight compared on the left side and the right side. If you really look at your shoes, or even the sandals or anything that you wear more often, you will see that the degeneration is different, or the way it changes the sole is really different. And why is it? Because your weight bearing is different. Now imagine your own body having a weight bearing which is different from the left side and the right side. Ideally it has to be the same, but yes, it goes differently. Why? Because you have a changed weight bearing pattern. And when does this changed weight bearing pattern come? It comes because of an injury, it comes because of some sort of issue or anything that you have done, because of which this weight bearing pattern can come. So this also, the chiropractic session also helps you to correct that, because of which your gait can get better, and you will instantly see that lightness in your body. Sometimes you can also expect a little bit of soreness in the next 24 hours. So I always tell my patients that probably there can be a little bit of soreness, because of which you can do some icing to it, and yeah, that can help to relieve you from that icing. So yes, this is what you should be expecting, and yes, followed by the chiro is also some exercises which you should work on. So one last question that I will take up is how often I need to see a chiropractor. One more question is, how often? A lot of people feel that you need to do about 8 to 10 sessions with a chiropractor, and that has to be done on a regular basis and things like that. See, we need to understand one thing here. We are making some changes at the skeletal level. Okay, so obviously one session is not going to do the job. A lot of patients come to me with that expectation that one session will do the job completely. That is something that is completely wrong. Even when we are doing camps, I keep telling my patient that if you have a severe problem, then you should see me on day 1. You should not see me on day 3. Because if you see me on day 3, I'll be able to do only one session for you. Normally my camps are for 3 to 4 days. Okay, so it is not logical for me to kind of see you on day 3 and then prescribe you exercises and that's it. Because if you have to follow, it has to be only after 2 months. So it is advisable that you see me on day 1 if you have a serious issue. And even for people who come to me in Thane and Mumbai on a regular basis, they feel that one session is going to do the job. I normally see these people after a week's time, or sometimes if it is very severe, I see them within 2 days time. So normally I would say you will need about 3 to 4 sessions to get better. Okay, now these 3 to 4 sessions will depend on your problem and how can we place these sessions, whether it can be in a weekly basis or It can be maybe once in 3 days, once in 4 days, or once maybe sometimes even alternate days. So based on that, we can decide, depending upon your problem, we can decide what should be the frequency of the session. But I normally see that 3 to 4 sessions is something which you should look at on a consistent basis. And if I'm able to make you better, it is only 3 to 4 sessions. If not, then probably Chiro is not for you. We cannot work on that. So it makes sense that we find out different therapies also. Okay, so this is what about frequency of how often we need to see a chiropractor. And also most important thing is, how much of importance does physical activity have in your life? If you are an athlete, if you are a sports person, if you are someone who's into physical activity quite a bit, then you need to see a chiropractor more frequently. Sometimes we also end up doing 3 to 4 sessions in just a week for athletes, for an upcoming session or for an upcoming competition, and that's mandatorily required. So yeah, for people who are more involved physically, more frequency of chiro is required, and it does help them to kind of attain their flexibility. It does help them to kind of stretch well. It does help them to kind of improve on their exercise quality, and I think this is what we look at the end of the day. Right, so yes, that was my last question that I had from the collection. And if we have any live questions here, yes, I think we have one more live question. Thank you for answering. Kanna says, thank you for answering in detail. Could you also have an idea? Please send me a DM about the charges, and yes, I will. I'll get back to you. So send me a DM for the charges, and my team will connect with you. Thank you everyone for joining in. I hope you had a nice live session, and do put in your questions in the comment section. And yes, we can always take up your questions in the next live session. I'll be doing these live sessions on a consistent basis, and yes, we can talk and we can understand about this science which is about 100 years old. The practice for chiropractic therapy is going on for the last more than 100 years, and its descriptions and its history goes back to almost 5,000 years. It is even mentioned to a great extent in Ayurveda. It's one of the part of Ayurvedic therapy. It is also followed very well in Chinese therapy. So that's the kind of age that chiropractic therapy has. So we are not talking about something which is developed yesterday and we are following it up today. It's been followed for about 100 years in the past, for the past 100 years, and it has given some good results, because of which it has been able to sustain to this extent. So thank you so much for joining in, and looking forward to see you for the next session. This is your Chiro and Physio Dr. Sudarshan Singh. Thank you.